Hello and welcome back to Dr. Happy Vagina. My name is Dr. Ida Bergman and I work as a gynecologist in Stockholm in Sweden. And I have started this YouTube channel to educate about women's health. And in today's episode we will speak about surgical treatment of stress urinary incontinence. And specifically today we will speak about Bulkamid. Previously I have an episode about TVT, the mesh surgery. So I recommend that you start by watching that video. And if you don't know what stress urinary incontinence is, I also recommend that first you look at that video so you understand what kind of condition we are speaking about and trying to treat here. And after you can watch this video about Bulkamid. So what is Bulkamid? Quickly, stress urinary incontinence. We have a problem with the support for the urethra. So here we have the urethra, you have the bladder, and underneath the urethra we have supporting ligaments and fascia. We have a muscle around the urethra and we have pelvic floor muscles around the whole system. And if we have damage to these tissues, normally from a vaginal delivery, which is the strongest risk factor, we can lose the support for the urinary bladder. So the support starts to bend, and when we increase the pressure from the abdomen, for example, when we cough or we sneeze, we laugh, lift something, we jog or run or do some kind of physical activity, we increase the pressure on the bladder, then the supporting systems are not strong enough to hold the urine in place, and we will have small drops of leakage. And in the previous video I was speaking about the tension-free vaginal tape, the TVT procedure, where we put in a mesh hammock around the urethra to give an artificial support for the urethra. But there is another way of treating this condition that we call Bulkamid. And Bulkamid means, I will draw a new picture, a little bit bigger picture. Here we have the urethra, we have the bladder. So Bulkamid means that we go inside the urethra with a camera. We call this cystoscopy. And with a small needle, we perforate the wall of the urethra and we put small balls around the urethra to close and make the urethra more tight. So we kind of put small bolsters around the urethra. And this procedure we do on a patient who is not sedated or in anesthesia. We put only local anesthesia in the urethra, sometimes only gel, or we put local anesthesia with an injection around the urethra. The procedure takes just a few minutes, and after that you can go home after we check that you can void. And there are, of course, some small risks, but the risks with Bulkamid compared to the TVT procedures are less. You can feel some kind of irritation in this area right after the procedure. Sometimes it can be difficult to void in the beginning because it's little swollen and irritated. You might have to use a catheter the first day, which is very uncommon, but this can happen. You can have also a urinary tract infection because we go inside, we can insert accidentally bacteria in the bladder when we do this procedure, even if we give prophylactic antibiotics. But otherwise it's quite a risk-free procedure. It's not zero risk, but it's less risk than with the TVT procedure. So when Bulkamid came on the market, us gynecologists and urologists in the scientific field were wondering what is better, which one should we recommend to our patients? Bulkamid versus TVT. And we have a research group from Finland who has answered this question and have performed a randomized controlled trial. And the 3-year follow-up from this study was published in 2022. We have a 1-year follow-up, 3-year follow-up, and now we are waiting for the 5-year follow-up from this study. And the patients, they were recruited between 2015 and 2017. And we had 24 women with stress urinary incontinence who were recruited to the study. And half were randomly allocated to Bulkamid. So it's like you throw the dice. It's random allocation, and half were randomly allocated to the TVT procedure. And I want to mention that some of the women, they start with 1 injection of the Bulkamid, and then you can wait a few weeks or a few months, and if your incontinence symptoms is not good enough, then you can refill, put a little bit of extra Bulkamid to fill up the urethra. Usually you don't do more treatments, but you can do 1 or sometimes add extra second treatment before you are satisfied. And the follow-up, I will speak about the 3-year follow-up because this is the most interesting part. If we have good results in 1 year but they decrease over time, it's not really interesting. So we want a treatment that gives a good cure rate and that stays for a long period of time. So we have the 3-year follow-up, 3 years. And in this study, the research group chose to ask the women, how satisfied are you now with this treatment? And they answer from 0 to 100. And if they answer that they are 80 or more satisfied, between a figure of 0 to 100, then the research group say, okay, then this is a cured patient. This is a meaningful, effective treatment. So if you have 80 points or more, it's treatment success. Okay, and now we come to the results. So the TVT group, when we follow them up after 3 years, we have a total of 95% of treatment success. And in the Bulkamid group, it was less. It was 68% who were satisfied with the treatment. So we see here the TVT procedure is winning over the Bulkamid. However, the risks with TVT was higher, even if the risks in both groups were very, very low. It's more common with severe complications, or both minor and major complications after TVT compared to the Bulkamid. So the risks are in benefit of Bulkamid. And so this gives a little guide to you women. It depends on your preferences. Also, we know that with the TVT procedure, we have 30 years of follow-up. And in this 30 years follow-up study, we see that the majority who gets a good effect will have the effect remaining over time. And Bulkamid is a newer procedure, so we don't have long-term data on the Bulkamid. Also, some women ask, but can I start with Bulkamid? And maybe I am one of the 68% who will be cured. And if I'm not cured, can I put a TVT band after to add on a TVT mesh? And the answer is yes. You can combine these treatments. The same with TVT. If you are not happy after a TVT procedure, you can go and proceed to inject Bulkamid bubbles in your urethra. And you have to choose. Some women are thinking more like, I want a durable, long-term treatment with high treatment success. I am willing to take the risks. When some women are more afraid of the risks, they want as minimal risks, and they can accept that maybe they will not be cured with this Bulkamid treatment. Okay, I hope you got some new knowledge and information today, and I will see you next week to speak more about women's health. Thank you.